There are some antithyroid substances that suppress the thyroid hormone secretion. These are the best known antithyroid drugs are the thiocyanate, propylthiouracil, and high concentration of inorganic iodides. All of these drugs have different mechanism of action in blocking the thyroid hormone secretion from the thyroid gland. We'll study them in detail one by one. The active pump, that the iodide pump that transports the iodide ions into the thyroid cells, can also pump thiocyanate ions and perchlorate ions and nitrate ions into the thyroid cells. Therefore, the administration of thiocyanate in a high concentration can cause competitive inhibition of iodide transport into the cell. That is, there is in this leads to the inhibition of iodide trapping mechanism. The decreased availability of iodide in the glandular cells does not stop the formation of thyroglobulin, so there is accumulation of thyroglobulin in the thyroid follicles. This deficiency of thyroid hormone in turn leads to the increased secretion of the TSH by the anterior pituitary gland, which causes the overgrowth of thyroid gland, even though the gland is not making enough thyroid hormones. Therefore, the use of thiocyanates and some other ions to block the thyroid secretion can lead to the development of a greatly enlarged thyroid gland, which is known as goiter. Propylthiouracil is another drug that is used to suppress the thyroid hormone synthesis, and this hormone decreases the thyroid hormone secretion. This drug and the similar drugs methimazole and carbimazole, they prevent the formation of thyroid hormone from iodides and tyrosine by blocking the peroxidase enzyme, and they also block the coupling of two iodinated tyrosines to form T3 and T4. These drugs do not prevent like thiocyanate, they do not prevent the formation of thyroglobulin. This thyroglobulin plus the increased secretion of TSH from the anterior pituitary gland, which is due to the lack of negative feedback from the deficiency of thyroid hormones T3 and T4. So there is increased TSH secretion, which results in increased growth of the glandular tissue of the thyroid gland, and the increased synthesis of thyroglobulin. Both of these effects lead to the increased size of the gland that leads to the formation of a goiter. Iodides. Iodides in high concentration, almost 100 times the normal plasma level, stop most of the activities of the thyroid gland, but this happens only for a few weeks. This inhibition is known as Wolff-Chaikoff effect. The iodides decrease the iodide trapping and iodination of the tyrosine, and also the normal endocytosis of colloid from the follicles by the thyroid glandular cell is paralyzed. There is almost immediate shutdown of thyroid hormone secretion into the, as iodides in high concentration decrease all phases of the thyroid activity, so they slightly decrease the size of thyroid gland and its blood supply. This effect is opposite to the effect caused by most of the other antithyroid agents. For this reason, iodides are frequently administered to the patients for 2 to 3 weeks before surgical removal of the thyroid gland to decrease the necessary amount of surgery and especially to decrease the amount of bleeding.